Hi everyone, it's Mark Polenkars from the Rath Building in downtown Buffalo with another COVID-19 update for people in Erie County. I'm pleased to be joined today by Dr. Gail Burstein, who is actually in a different part of the Rath Building, and you'll be seeing from her very soon, as well as Karen Gambino from Deaf Access Services, who you should see in the screen already, as we give you the latest update on COVID-19 outbreak in our community. As usual, we have the little provisos that the information is as valid as it was when the presentation was created. So it's always sometimes subject to a few changes, but I just want to remind everybody that the information you see in the PowerPoint is as effective as when it was created and finalized, which was about 2 p.m. And as usual, there's always some changes that go on. I want to remind everybody that we have a new testing protocol in place, and with that I'm going to put this earbud on so I can hear Dr. Burstein, who's going to talk about the new testing protocols. Doctor.
Thank you, Mark. You're hello from a distance, socially distant. So as of today, we have some new guidelines for people who we are going to test, and we made these in collaboration with our big partners in testing with Kaleida Health. And so I think the biggest change is that all essential employees will be able to get tested who are symptomatic. So that would include people who are working in hospitals and other community settings. So that would also include frontline folks that are not just the physicians. That would include nurses, mid-levels. There's include people who are working in the in food service or in cleaning the rooms. Anybody that might come in contact with a patient in the hospital or in any type of healthcare setting. So even the receptionist at a doctor's office. So we're also testing symptomatic EMT, fire, police, and our corrections staff. We are also testing symptomatic household contacts or significant others of community healthcare workers and hospital-based healthcare workers. And we're also testing people who are symptomatic who are receiving dialysis or infusion therapy. So again, the big change that we want to emphasize is that we are including all essential employees in our list of symptomatic people who we are testing. So you might ask, what is an essential employee? And I'll answer that those are people who are working at businesses that are considered essential under the New York State Executive Order 202.6. And so that would include people who are working in places where we need to stay open. So that is grocery stores, pharmacies, or other type of stores that we need goods because those are essential to us. Our people working in utilities, we have to keep the lights on and the heat on, especially now where it's so cold out. People working in childcare. So any of those type of positions are considered essential by New York State and essential by us. So, we can have the next bullet. So everybody, so people are asking, well, where do I go for testing? So those would be, so everybody who is screened and approved for testing is given a location and an appointment time where to present for the actual specimen collection. And so, and then also at that time when they are, they're given their specimen is collected, their nasopharyngeal swab, they're also given information about how to remain in isolation. So they're given standing orders. So that's a legal order for people to be in isolation, and instructions how to be in isolation, and instructions about how to return to work and how to get out of isolation for, and then how, and then for people who are quarantined, what they need to tell those individuals. And then people will be able to attest that they've completed the isolation and give that to their employer if they need to. So they'll get all that information when they have their specimen collection. And so if they receive a negative test, so that information is not relevant to them and they can dispose of it. And if they have a positive test result, then they are, they have the commissioner order for isolation and they have to adhere to that. And someone from the health department will contact them and go review those instructions and then get information about their close contacts. And then we will contact those close contacts and let them know that they need to remain in quarantine for a 2-week time period. So, just for what you need to get tested. So for the Erie County Health Department, we do not require a physician prescription. We still think it's very important that people who have questions about their health, so they're symptomatic and they think they need to get a test, they should still contact their healthcare provider and review their symptoms with their healthcare provider and get recommendations for management. But again, not having a healthcare provider is not a barrier to care. For people that call and they don't have a healthcare provider, we actually have a list of healthcare providers in the community that are accepting new patients. And we want to share that with you and encourage people to register and sign up for a new relationship with a healthcare provider. So people who are going through the Erie County Health Department for testing, they can call 716-858-2929 for that testing process. Collider would like to test people who do have a healthcare provider. So if you have a healthcare provider, we encourage you to contact Collider Health and either going to their website at colliderhealth.org or calling 859-3222. Again, that's 859-3222. Thanks. I'll have the next slide.
Yep, I think we've got that covered now, Doc. And
Yes,
I want
thank
to
you.
appreciate you and the Department of Health being able to expand the testing for our greater community. We realize that there's a great need in the community, and we're very pleased that we were able to expand the testing to essential employees. This is not every individual who wants a test. It's essential employees, those that work in the grocery stores, utilities, transportation, and the like. And we ask that people follow those recommendations on the screen. If you have a healthcare provider, you can go through your healthcare provider, but if you don't, you can contact the Erie County Department of Health, and we will determine and set up an appointment for you. If you are symptomatic, that means you have to have symptoms. If you don't have any symptoms, the test isn't going to do anything for you. But if you have symptoms, we are testing individuals for all essential personnel, regardless of what industry they're in. I want to go on to the next slide, which is cases, deaths, and hospitalizations. As of 2 p.m., there were 2,023 total positive cases, all labs. These are not presumed positive. These are confirmed positive cases. There are 115 people who unfortunately have died. These are all known confirmed positive cases before death. There are no presumed positive cases once again, and I do want to offer my deepest condolences to all who've lost a loved one, friend, or family member due to the COVID-19 outbreak. 8 more deaths since the last report yesterday, so we continue to see a number of deaths on a daily basis. And when it comes to hospitalizations, we have 232 individuals as of April 15th. Remember, we get the data at the end of the day after, and so that would be basically around 6, 7 o'clock last night. We get data for the day before. So as of the end of April 15th, there were 232 people that were in hospitals in Erie County for COVID-19. 109 of them were in the ICU, and 95 of them had an airway assist. And I'm just going to turn it over to the doc to talk a little bit about the hospitalization chart and what this potentially may mean. So, Dr. Burstein?
Sure. So this is these are data looking at the total hospitalizations in blue and the ICU admissions in red, and then those admissions that need some type of airway assistance in green, starting from April 2nd through April 15th. So you can see that we've seemed to reach sort of a steady state. We are seeing a very, very slow increase in total hospital admissions. However, with the intensive care unit admissions and the assisted airway admissions, we're sort of flattening out. And so that's a combination of the the hospitals increasing bed capacity, and especially in their subacute care facilities. So people that no longer need a acute care facility, they're well enough to be discharged from that high level of care, but they're not quite ready to go home, and they still need some supervised care. They are discharged to the subacute care facility, so they don't take up a hospital bed. Also, the hospitals are being very smart and trying some innovative strategies to keep people, off the ventilators and needing any type of airway support. And then also, I think from the front end, that we know that that the hospitals, especially Kaleida is working with Elderwood and the county health department to work with the nursing homes to make sure that they're doing what they need to do to keep their residents healthy and COVID free. And if there is seems to be a COVID outbreak, helping the nursing homes, appropriately isolate and manage those people, again, to try to prevent those new admissions coming into the hospital. So I think, all together, working together as a community has really benefited us. So this slide is looking at the difference between hospital admissions, so new COVID cases, which includes people who are newly admitted to the hospital that already have a diagnosis of COVID-19, and then also people who were admitted to the hospital, and then during their hospital stay, they have a positive COVID-19 result. So those are new COVID-19 cases identified in the hospital, either through new admission or somebody tested who's already in the hospital. Where the green line is are discharges from the hospital. So you can see that the good news is that lately it seems like our discharges have been higher numbers than our new COVID cases into the hospital. So that's the direction that we're hoping that we can continue heading. Next slide. So these are looking at demographic data of our admissions, our last admissions through this morning. And so on the left-hand chart, you can see that we're stratifying admissions by age and by gender. And so you can see it's fairly similar, gender, male, female. It's pretty equal, and you can see that in the chart to the right. However, with age, we can see that throughout the adult period, people in their 20s through people in their 80s, there's similar percentages. So I think that what that tells us is that all adults are susceptible to symptomatic COVID-19. So all adults can get infected. We also know children can get infected. Fortunately, there are a few lower proportion of children who are infected with COVID-19 compared to adults. So we're not identifying as many of the children who are infected, but we believe they're still out there. We're just not testing them because they don't have symptoms. Because remember, we're just testing a very select portion of the population, and that's going to expand today and beyond. But however, it's not everybody in the community, whether they're symptomatic or asymptomatic, are getting tested. So these numbers are really reflecting of who is getting tested. So here we're looking at the ages of our, unfortunately, the people that have died from COVID-19 and their percentages. So you can see that by far our seniors are most at risk. So people in their 60s and up. Again, that really should stress the message for us. If we have seniors in our lives, we really have to make sure that we're watching out for them, that we're monitoring their symptoms, hopefully from a distance, and that and we're making sure that they don't have to go out and get food or their prescriptions without having to go out, because there are really, really precious assets in our community. So we have to make sure that we care for them, because we know that they're really at risk of becoming very ill with COVID-19. Next. So these data are looking at our COVID-19 cases through yesterday by race, ethnicity, and gender. So you can see that, with our fatalities by race, ethnicity, and gender. So you can see that just in terms of the fatalities, that there are about 75, almost 75% of our fatalities are white, and about 25% of our fatalities are Black or African American. And then about 2 to 3% are designated, identified as Hispanic Latino. So and then here, this is also, reinforcing the health disparities that we're seeing in our community, because we know that about 15% of our Erie County population is listed as Black or African American for our census. However, about 25% of our COVID-19 related deaths are Black or African American. So that, highlights the health disparity that we're seeing in Erie County and throughout our community. And so, and throughout the nation, they're seeing this. So, so we're really working hard with our community members to see, how can we address these health disparities. So I'm going to turn it over to Mark to talk about Erie County versus other counties' morbidity in COVID-19.
Thank you, Dr. Burstein. I want to thank you for that. We have seen a reduction in the percentage of deaths with regards to African Americans. The doctor noted, it's about 10% higher than the actual population of African Americans in Erie County. Hispanics actually are less than the average population of Hispanics in Erie County. That's a little over 5%, but we still have too many individuals of people of color who are perishing above their percentage of the population, so we continue to work with our partners in the Health Disparity Task Force to address that. Now, someone yesterday said we should stop doing comparisons and look at ourselves not necessarily as per se to New York City and downstate, but to our peer group in the Great Lakes in our region around here. And I don't think we've ever made a comparison to New York City, but I thought it made sense to take a look and see where we compared to Cuyahoga County, Ohio, where Cleveland is, and Allegheny County, Pittsburgh, or Pennsylvania, where Pittsburgh is, because there is a fair comparison there. Unfortunately, what we found out is we have more cases and more deaths than those two regions, which actually have 300,000 on average more people that live in their counties. So when we take a look at Allegheny County, where Pittsburgh is, they have 925 cases and 38 deaths. Looking at Cuyahoga County, where Cleveland is, they have 1,331 cases and 42 deaths. And then we look at Erie County, and this is as of yesterday's data. We wanted to do a data apples for apples comparison. We had 1,951 cases and 107 deaths. I looked at testing too. I actually looked at this data myself. And what we saw in Allegheny County, they tested about 10,864 people. In Erie County, we've tested 7,762 through yesterday. They are not listing the amount of people tested in Ohio, so I can't say exactly how many people have been tested in Cuyahoga County, where Cleveland is. But when you look at the chart, it is fairly striking when you see this chart here, that here are two communities that aren't too far away from us. They're all about a 3-hour drive. And they have 300,000 more people per county, but we have more cases and more deaths. We actually have basically 3 times as many deaths as Allegheny County, Pennsylvania, and we have over double the deaths of Cuyahoga County in Ohio, where Cleveland is. So when people are saying, "Oh, we're well past this, we don't have an issue here," we do have an issue. When here are 2 counties that have, on average, 300,000 more people than we do, and we have more cases and we have more deaths, and in comparison to Allegheny County, where Pittsburgh is, we've tested approximately 25% less people. It is a concern that we're going to continue to focus on this issue, that this is not a hoax, that this is real, and it is having an impact in our community like it is in other parts of the country. So I wanted people to understand that we were going to do this analysis to take a look at it, and we did, and it doesn't show that we're better than these communities. It actually shows as a percentage of our population we're worse. I'm not certain why that is. I don't know if it's because of just the higher counts in general in New York State. But here are 2 communities that we are pretty close to as communities distance-wise, and I know a lot of people go to Pittsburgh, a lot of people go to Cleveland, and we're just not seeing the comparable numbers that we should see for being these communities that are within a 3-hour drive of each other. There can be no comparison with New York City, Long Island, but we can make a comparison on these communities, and we're not doing as well as them, and I don't know the answer why. I don't know if it's an issue with people not following the rules and regulations with regards to staying at home. I'm not certain if there were different actions that were taken in those communities compared to what we've done here. I think it's fair to say Pennsylvania has been working in concert with the New York State. Governor Wolf has been working in concert with our governor, Andrew Cuomo, and Governor Mike DeWine in Ohio has put in some fairly tough measures as well. But for whatever reason, we're not matching up as well as we should compared to those communities, and it's a little disheartening because that means we just have more of it here and we have to do more to address it, and we will continue to do more. Next slide, mapping. Of course, you can go online and see the county's mapping slide as well as New York State's, but I find it very productive looking at New York State's one is it gives the actual total number of cases and individuals that have been tested, and that's that 7,672 number, but it also knows the positive rate, which is about 24%. Now, everybody who's been tested is symptomatic. It's not like we're going out there and testing people who don't have symptoms. We know there's a really bad bronchial illness out there that is not necessarily COVID-19. There are folks that have bronchial pneumonia, just plain old pneumonia, and bacterial infections. So thankfully, 75% of the people that have been tested in Erie County have been negative. But it just goes to show that there's a lot of illness out there that's not directly related to COVID-19. And there are individuals who are in the hospital with pneumonia who don't show up in our hospitalization numbers, but do show up in our total numbers of hospitalizations because they have a different type of pneumonia. Maybe not COVID-19 pneumonia, but a pneumonia from a bacterial infection or bronchitis. So I think it's important for media and others to keep track of that number with regards to testing. We expect the testing number to rapidly ramp up now that the county as well as Kaleida Health are doing more tests for essential workers. We expect Kaleida is going to be able to do maybe up to 400 tests already per day, hopefully up to 500 a day by the end of next week. The county is ramping up our numbers too. So don't be surprised to see the testing numbers go up dramatically in the next week. That's a good thing. But we'll also, as a result of that, probably come up with a lot more positive cases. And it gives us a better indication of what's happening in the greater community. Now, with regards to Erie County's response, there's something that we've been working on quietly behind the scenes, but I think it needs to be brought up with the public, and that is the impact that COVID-19 is having on not just Erie County's budget, but local governmental budgets all across Western New York, New York State, and of course America. But to do that, I have to do a little understanding of the Erie County budget. On the screen, you see the Erie County budget expenditures. We got about a $1.73 billion budget. Got a big budget. Not gonna say we're a small entity because we're not. We're a big entity. If we were a private sector entity, we'd be one of the largest private sector entities in all of upstate New York. But roughly 50% of that budget goes to health and human service issues. So the health department, the social services department, those types of services, temporary assistance for needy families, the supplemental nutrition assistance program, roughly 50% of those of our budget goes to those programs. And what we've seen as it pertains to the supplemental nutrition assistance program, as well as the temporary assistance for needy families program, other programs that are mandated to be provided by Erie County, as we've seen huge increases in our caseloads. We used to get like 30 or 40 sometimes new cases a day. We're getting hundreds and hundreds of new cases a day. And our budget was predicated on what was the usual expectation for this year based on the normal number of cases. We have hundreds and hundreds to getting to near the thousands of new cases. Actually, I should say that. We have thousands of new cases for a lot of these social service programs that our staff is working on, many of them from home. And it has made it difficult because we have to provide these services. Now, that means we're going to probably have to spend more money on these programs, even though some of them are federally reimbursed in the long run, but we have to spend the money up front. Now, that takes us to the next slide, which is in regards to our revenue stream. Remember, $1.73 billion budget. We receive hundreds and hundreds of millions of dollars more in sales and hotel taxes than we bring in property taxes. We've brought in the vast majority of property taxes that we're going to get this year already, but we are very worried about our sales tax, hotel tax, and other fees that we often generate. And why does this matter? Because we are talking about, based on estimates from the federal government and national economists, that Erie County could lose upwards of $140 million of revenues. This is significant. It's greater than what we have in our piggy bank. If we lost all of that, I do not want to spend all of our piggy bank, our fund balance, to make up the hole in the budget. And that's why it's very important that the federal government do what a number of us in governments across the United States are calling for, which is passage of the federal stimulus package number 4. The county is going to receive, we don't have it yet, but the county is going to receive direct money to assist us with the response to the COVID-19 outbreak. It will not adjust any of the shortfalls we have or the new caseloads that we have in other areas. So without additional federal assistance, Erie County and other local governments will be faced with significant revenue shortfalls. And when I say local governments, it's because we share a significant part of all sales tax that are received by Erie County with the cities, the towns, the villages, and school districts. Roughly 46% of every dollar that Erie County receives from New York State from sales taxes gets shared with our cities, towns, villages, and school districts. And I know many of them are very worried about their economic futures, just like we are worried. So without additional federal assistance, Erie County will be forced to take further action to balance the budget, including using fund balance and unfortunately targeted cuts to programs. Right now, every employee is getting paid. Every employee is getting their health care. There are employees that are furloughed at home, but they are getting paid. So I want to thank our employees and our workforce for the great work they're doing. Some that are non-essential are home, but I did not want to cut off their salaries and then basically have to put them on the unemployment line. We need that revenue going into our community, and I thought it was fair to continue to pay and provide them health care. But if this continued for a substantial amount of time, we are going to be faced with a very difficult choice, which includes targeted cuts to programs, including most of our discretionary programs, except for just some of the basic ones that we have to provide, and also some layoffs. I am hopeful we do not have to do that, and that's why I've called on Congress and the President to pass a 4th round of federal stimulus package to ensure stability with all local governments. If we do not get the federal stimulus assistance that is being discussed right now in Washington, Erie County is going to be in a bad financial situation. All local governments are going to be in a very difficult to bad financial situation. It is projected that we need, the federal government needs to pass another $600 billion at least assistance for just federal governments or local governments alone. Erie County, as I said, is projecting a loss of potentially up to $140 million based on the most recent national economist estimates of what our losses are going to be. So we are very, very concerned, and our budget office is looking at these numbers, is working with our partners in federal government. I want to thank Congressman Higgins because I know he's been a strong advocate, as well as Senator Charles Schumer, the minority leader, and our second Senator, Kirsten Gillibrand. They've been supportive. There seems to be a fight going on in Washington, D.C. right now as to whether or not this should happen. It must happen. If it doesn't happen, all local governments are going to be in a horrible situation, and we're going to have to take drastic actions that we do not want to do, including cutting of some very important programs that the public likes, as well as laying off employees, which I really don't want to do, and I would much rather have those employees working. That's why we're working hard to bring back as many employees as we can. But unfortunately, we are still under the pause orders from New York Governor Cuomo, at least through May 15th, and as a result, local governments were forced to cut our staff by 15%, or 50%, excuse me, 50% on site. And it has been tough delivering some of those services, but we have been able to do it, and I want to thank our workforce for doing that. So with that, I just wanted to say to everyone, there is this budgetary aspect that we're dealing with and will continue to deal with. And I just thank everyone's patience as we've moved along to address the issues of the COVID-19 outbreak, but also know it is having a very, very negative impact with regards to our finances and, for that matter, most local government finances. And that's why it is so essential that Congress and the President pass a stimulus package number 4 that provides help for local governments to offset these giant shortfalls we'll be receiving. The prior stimulus package gave us money to respond to the COVID-19 outbreak, but it specifically said it cannot be used to address shortfalls in your budget. And that's why it's very important that stimulus package number 4 be passed. Finally, of course, our COVID-19 call center is open from 8 a.m. to 8 p.m. at 858-2929. Various times the call volume is high, other times not so bad. Once again, if you have a question related to healthcare, call 858-2929. And if you are one of those essential workers who is symptomatic and you are looking for getting tested, you call 858-2929 and you push option 2. And you will be directed to a member of the Erie County Department of Health staff that'll make the determination as to whether you should get tested, and if then what will happen. Now, for those who get tested, I do want to put this out there because I think it's very important to know. If you are going to get tested, you have to be in isolation. It's not like showing up and then going about your business. If you are symptomatic and you are being tested, you have to be in isolation until you get your test results. And if your test results come back positive, you got to be in isolation afterwards. If negative, good for you. Congratulations, you don't have COVID-19. But you should have been in isolation beforehand. You shouldn't be going about your business if you've been tested and you're symptomatic. So I think it's very important that people understand when you get approved for testing, you're getting an isolation order from Dr. Burstein and the Department of Health saying you got to stay in isolation. You can't go to work. You can't be around even family members. You have to be in an isolated situation. So I just want to remind folks that when you're calling to get tested through our 858-2929 number, you are symptomatic, you have the illness, and you are put in isolation until you get your test results. If they're positive, you stay in isolation. If they're negative, well, you can come out of isolation, but you probably still have a health issue that needs to be resolved by your doctor. But you can call the call center, 858-2929. If you are seeking a test and symptomatic as an essential worker, you push option 2. If you're just asking a basic question, there's another option for that, and we have employees that are ready to answer your questions for you. And of course, our COVID-19 webpage is updated daily. That's www.erie.gov/COVID-19. And with that, we'll open up the phone lines to questions from the members of the media, and I thank them for their waiting here. We will start off with, at the bottom, with the W's. So we'll start off with Western New York Media. Anybody from Western New York Media? If not, we have Ashley Rowe from WKBW. Ashley?
Hi, Mark. Thank you very much. I want to chat about the effort to help people who are struggling to cope with the crisis. I'm curious as to what kind of traffic there's been to the crisis services hotline since this all began. And then a second part to that question is what added measures are being considered to help people deal with this hit to the mental health?
Thank you for the question. It certainly is something that we've been talking about, including during these press briefings, providing information with regards to the crisis services hotline. I don't have the exact number of calls increase or decrease. I can't really say. I don't know. Dr. Burstein, did you hear that question?
I did, thank you. I don't know exactly the number of calls that crisis services has been receiving. I know that our community healthcare providers are accepting patients and they're able to provide counseling services virtually. So people shouldn't hesitate to reach out and call one of them. And on the COVID-19 website, there's a list of numbers for all these providers, mental health providers that can provide services. And then also there's a number where a New York State number that people can call. They just, want to talk to somebody and they, have stress and they don't want to really engage in a relationship with a provider, but they want to talk to somebody. So those are available too. So as our county executive mentioned, we are very concerned about people's mental health during this crisis, and we strongly urge people that to remember they are not alone. They can use their phone to reach out to their friends and family. I mean, your friends and family are just as alone as you are. And then also, if you think you need to speak with somebody that has some skills and experience with helping people manage anxiety or depression, so go to our website and look up those numbers or call crisis services. There is help available, even if you can't go outside.
You can always go to our Erie County Department of Mental Health website, which has a listing of various providers and can give updates. And we'll also look into, Ashley, whether there's been an increase of calls to crisis services and get back with you on that.
Thanks very much, Mark.
You're welcome. Next is WIVB-TV, Mel Orleans.
Hi, Mark. Thanks for taking our questions this afternoon. Mine's specifically about nursing homes. We're hearing a lot from Governor Cuomo about local nursing homes and nursing homes across the state not reporting cases to families or notifying them in a timely manner. We were wondering if the county has heard any specific complaints that local nursing homes or assisted care facilities aren't complying with this order to report to families in a timely manner.
We certainly heard of issues associated with the nursing homes, including the number of deaths. New York State has been providing daily an update on the fatalities from nursing homes in particular counties. We actually get the fatality reports with regards to particular nursing homes, but we cannot release them. It is New York State data, and they will not allow us to release it, but it gives us an idea of where there may be issues. I have not heard of a particular nursing home not following the governor's orders. And I think that would be very significant because nursing homes are regulated by New York State, and New York State could shut down the nursing home if they so choose. I don't know any nursing home that would want to risk being shut down. We need them in service, but if they're not providing accurate data and we're not getting information on whether their patients have COVID-19, that's a really bad thing. They should be providing accurate data to the family members.
Thank you.
WGRZ, Emily Watkins and Steve Brown.
Good afternoon. In regards to the sales tax revenue issue, how soon are those difficult decisions, minus relief coming or being on the way? I appreciate that you're going to the bond market to essentially borrow money, but how soon would those difficult decisions be for you if nothing changed from the way it is today?
What Steve noted is we are planning on doing a $120 million revenue anticipation note. Basically, we're borrowing money in the short term to pay it back a little later in the year under the assumption we'll have the revenues to pay it back. However, with the cuts that we're expecting, a potentially $140 million one, it's going to make it difficult unless we take drastic action. I'm looking at that we should be fine through April, but I am very worried about where we're going to be starting in May. If we are continued shut down for quite some period, I do not see us being able to continue to provide everything that we usually always provide starting June 1st. So we're going to be monitoring this through the remainder of April. I have no intention of laying anybody off at this point through the remainder of this month and early May, but if this continues, and it looks like it's going to continue, we're going to have to start taking some action starting in June.
Thank you.
You're welcome. WBFO, Michael Mroziak.
Good afternoon, Mark. How are you doing? In regards to federal aid, this morning the governor and the president had a very public difference of opinion, if you will. Are you concerned that if this spat flares up between those two, it could spill into the floors of the House and Senate when it comes time to determine additional federal aid?
Well, I would say that we have two very strong individuals, and one in particular in the U.S. Senate, that being the Senate Minority Leader Charles Schumer, our senior senator, who's going to advocate to ensure that New York gets its fair share. I think it's important for public to note that we're not getting money based on number of deaths. There's been some rumors out there that we're increasing the number of deaths because we want to get more money. That's not the case. We are allocated a certain amount based on population, and as simple as that. I'm hopeful that the president and the governor can put their differences aside. I know we have political differences. I don't agree with everything that the president does. I've not always agreed with everything the governor does. But during this time, we need to work together to address these issues. If we do not get an additional stimulus package to assist us with these revenues that are lost, it's not only going to have a negative impact in the short run, but it's also going to have a huge impact on where we are going forward, because all of our budgeting is predicated on how much revenue and so forth we generated during the year. And even though we know we'll get out of this eventually, we're very worried about the overall impact on our local economy, local businesses that are going to close. That means more people who are out of work, less revenue that's going to come into government, and that would mean less money that we'd even have going into 2021 and beyond. So it's very important that we get the stimulus aid to help us now during this really bad period, so that when we come out of it, we can come out of it as strong as possible. I'm hoping the president and the governor can just realize that we are all working together We don't always have to agree, but we do have to work together for the best interest of our community, and that means putting some of those differences aside. Maybe this is what you get when you have two guys from New York City battling. They can be a little heated at times, but we know here in Buffalo that sometimes you got to put that stuff aside and just work together as best as you can, like I have with my colleagues, not only locally across the party aisles, but nationwide, where I've been advocating with friends of mine, colleagues that are Republican county leaders across the country for the passage of the fourth stimulus package. Michael Baggerman, WBEN.
Good afternoon, Mark. I want to get better understanding of some of the context with the nursing home figures. New York State Department of Health says that there's 26 deaths from 3 Erie County nursing homes. Yesterday, though, you tweeted out that there were 42. What's the context between the numbers that we're seeing here?
We believe well, first off, we have data from New York State that shows deaths at a number of nursing homes, just not 3 nursing homes. There are 3 nursing homes that have the majority of the deaths, but they're not the only 3 nursing homes to have had deaths.
So where did you get the 42 figure from? Are those different nursing homes reporting to you directly and the state just hasn't released it yet?
No, the state, I think actually at one point the state had may have identified 45 nursing home deaths in Erie County, but some of those may not be a county resident. They may be someone who's temporarily at a nursing home, but may have been a resident of Niagara County or Wyoming County, Orleans. We don't get separate data from nursing homes. That comes directly from New York State. Next question, Stephen Mart, Spectrum News.
Thank you, County Executive. We're seeing a number of events pop up on Facebook from a number of local groups calling to free Western New York for Governor Cuomo, saying that we are nowhere near as serious as New York City and that business and normal day of life should kind of open up. They're calling for vehicles to flock to Niagara Square, people to march with signs. I wanted to know if you were aware of these calls for this event, and if so, what your thoughts were on it.
Well, I certainly am aware. We've been advised about these events. People have a right to voice their opinion. They have a First Amendment right. We are certainly going to be concerned about if they're congregating in a location, because remember, there are pause orders that says you can't be in a situation where there's more than 10 people. And I know that some of these folks don't care. We're right now have the order going into effect regarding masks, and I've got my mask here that I'm not wearing while I'm doing this event, as the people are far enough away, but we'll be wearing our masks, and I'm worried about these individuals showing up and not wearing their masks. We have COVID-19 across all of Erie County, all age groups, as the doctor noted, and I think people are underestimating the impact that it's having with regards to the health of our community. The people who've died, of course, but also the hundreds who have been sick, whether they're in a hospital or sick at home and not doing well. You don't want to go to the hospital if you can avoid it, and there's a lot of people. There's hundreds and hundreds of people right now that we were aware of that are in home with COVID-19 or are ill. So the people who are downplaying it are not paying enough attention to what's actually going on in our community. We are not New York City. I'll agree with that. But we are worse than Cleveland and Cuyahoga County. We're worse than Pittsburgh and Allegheny County, Pennsylvania. And that should let people know that it's not great here. I mean, we're working hard to alleviate it, but it's not like it's fine. And if we opened up tomorrow, those hundreds and hundreds of cases will be thousands and thousands of cases. And that's what we're trying to avoid. We're trying to avoid thousands and thousands of cases. And oh, by the way, I've heard some people say, well, it's only the old people that it's affecting, and who cares? Or just let them stay at home. My God, that's a horrible attitude. We're Americans. We're all in this together. There are people who have perished from this, and if you're a loved one or a family or friend of one of those individuals, you know how bad and hard it feels. There are individuals in their 30s from Erie County who've died from this. It's not just the elderly. And so those that are just care about themselves, that's not what this country's made from. It's made of. As I said a couple of weeks ago or a week or so, I'm kind of glad my grandfather's not alive. He was part of the greatest generation. Both my grandfather and my grandmother, they perished a few years ago. My grandfather went to war in World War II. My grandmother went to work while raising her children, including my aunt. My mother hadn't been born yet. I think it's very, very disingenuous for people to say, I don't care about anyone else. I only care about myself. Let's open it up. That's not the American spirit that we're made of. As I say, if my grandfather and my grandmother were here, they'd be smacking some people on the back of the heads while wearing their masks, because they'd be very angry at what they're seeing from people who don't seem to care about anyone else. We need to work together to alleviate this, and that's why we continue to do what we're doing. Aaron Bessaker from Buffalo News.
Hi, Mark. I wanted to ask about the updated protocol. I'm just wondering if you could shed some light on what's changed that's allowed, the essential workers now to be included as part of testing.
I'll turn that over to Dr. Burstein.
Sure, thank you. So it's really our community's testing capacity has expanded. So as County Executive mentioned, Kaleida has significantly expanded their testing capacity, and they're anticipating by sometime next week they'll be able to do 500 tests a day. In Erie County, we're able to do 100 tests a day, and so, or 80 to 100 tests a day. So we are expanding our capacity, and so we are able to do more testing, and so we are doing more testing. We want to do more testing, and so we know that the essential employees, the rest of those individuals will make up a significant portion of our population, and we're really happy that we can offer them testing now, because they're in the front lines, similar to the other people that we have been testing. And so, they deserve to get tested if they're symptomatic, and to identify if they have an infection, make sure that they're isolated, making sure that they are connected with a healthcare provider, and, making sure that they don't infect other people that they work with, because the other people they work with are also essential employees, and then understanding when they can return to work safely and continue wearing a mask. So, again, we have increased testing capacity of our community with our great partners at Kaleida Health and the county working together. And so we can test more, and we will test more.
Thank you, Doctor. Move on to Ethan Powers of B News.
Hey, Mark, hope all is well. Quick question about the hospitalization rate, and I know a lot of this data is in constant fluctuation. Last week there was a slight decrease in those admitted to ICU units, as well as a decrease of those on airway assistance. And yesterday, in talking about the hospitalization data, you mentioned how we are definitely not there yet in terms of our peak. According to the models that you have access to, are we still on schedule to see a peak in mid to late May, or have those models changed?
The models continue to show a peak in mid-May. And they also show that our hospitalizations will, if the models are correct, will go up substantially by the end of this month. Isn't that correct, Dr. Burstein?
Yeah, that's right. And remember, these are just estimates. It's like a weather forecast. So the farther that you push out the forecast, the less accurate it'll be. But the trends that are forecasted is that we will start to see an elevation and increase in hospitalizations within the next week or two, and we'll all wait to see what happens. But again, that can change, because what we do today and it's going to affect our numbers in 1 to 2 weeks. So if we are able to be consistent with keeping our social isolation, our physical distancing, and continuing to wear our masks when we go outside, and we might encounter other people, like in stores. If we continue to keep those frequently touched surfaces clean, keep them virus-free with good disinfectant, and make sure that sick people stay away from healthy people, then hopefully we won't see the type of peak that we could have. Again, we have some control over that, and that's why it's really important to continue with these social distancing and these other measures to keep our numbers down.
Thank you, Doctor. Is there anybody else in this first round that was not announced? If not, we'll go back to WKBW TV. Ashley Rowe, do you have a question? Anyone from WKBW? WIVB TV, Channel 4, Mel Orleans, are you still on?
I am still on. Just quick question in terms of the governor's pause order extension until May 15th. Do you feel like that will be Obviously we mentioned Erie County reaching a peak mid-May. Do you think that that would be an accurate time to begin reopening Western New York?
It's still too far out. I mean, it's almost a full month. I can't give the answer to that question. I'm hopeful that we'll have a little better data as we go along. There's a reason why we're doing the hospitalization chart on a 2-week rolling average, is so that we can see where we have been to 2 weeks. And we'll have a much better idea this time next week than we did this week as to where we are, if it's getting worse or getting better. We do know that people are still testing positive, and these are individuals who are just caught the coronavirus and COVID-19 recently. Some of them may have had it for a little longer, but others were just becoming ill. And a good example of that is Tonawanda Supervisor Joe Eminger, who just announced a couple days ago that he has COVID-19 after coming down ill a few days before. So there are people that are still attracting it and still are contracting it, I should say. And we expect those numbers to continue. Now that we're going to be ramping up testing, we're going to find out a lot more people in our community have it. And only more days of data will give us the information that we need to be able to make that determination of when is the correct time to get back to, or at least start to get back to, business as usual.
Thank you.
WGRZ, I know we had Emily Watkins and Steve Brown.
Yeah, question about the state data on fatalities inside nursing homes. I know that you've said that this is a state regulated industry, but you do see the data. Do you think there was a strong public sentiment, public interest reason for the state to have released this information earlier, if for no other reason than to make sure that people understood that this really is a life and death struggle?
I certainly believe that the more information and accurate that can come out from a facility, the better. I don't have the firsthand knowledge of being in the facility. I've talked to a couple of facility administrators who've also said part of their problem is they're taking in COVID-19 elderly patients who may not have been in that facility beforehand, so it can kind of skew the numbers. But I think the public does deserve to know, and family members at least deserve to know, if there are other individuals in the facility that their loved one is in that have COVID-19. Michael Moroziak, do you have another question, Michael?
I'm all set.
Okay.
I'm all set. Thank you.
Yep. Mike Baggerman?
Earlier this week, there was a new shipment of personal protective equipment into Erie County. Have there been any more that have come in since then?
Not of the N95 masks. We've had some others, and we distribute them based on the requirements with regards to who they go to, hospitals first, then other healthcare facilities. We are hopeful that we'll have larger shipments coming in. We are aware of a number of what appear to be real shipments, including some that are coming from other parts of the United States, not Taiwan or China. So hopefully by this time next week we'll have some more good news to announce. The last time I said it looked like we were going to have a shipment. We actually did get it in. So I feel much more confident now than I did a couple weeks ago as production has ramped up on a lot of these PPEs, but we're still not exactly where we'd like to be.
Is there still a high demand at local hospitals for the PPE, or is it better managed now than it was, say, a week or two ago?
Oh, there's high demand at hospitals, at doctors' offices, at nursing homes. We're getting requests in for PPEs that we just cannot fulfill from healthcare providers across this community. We have been able to assist the hospitals get their PPEs, but we get requests all the time from healthcare providers for more PPEs than what we can provide because we just don't have it in stock, and that's why it's important that we continue to get these updated shipments. Stephen Marth, Spectrum.
Yeah, thank you, County Executive. Just in the past couple hours, we're seeing a number of states like Texas, Illinois, Iowa, all announcing that they're closing school for the rest of the year for students out of an abundance of caution. Obviously, the governor has his pause order through May 15th, but based on the data that you just shared, based on the current models for Erie County, plus with what the White House Coronavirus Task Force is saying, with its phase-in model and how many weeks it takes to kind of transition between phases, do you think that at this point, with us getting so close to the end of the school year, that it would just make sense to close schools to kind of start anew later in the year, potentially, for the new school year?
I was on a conference call with superintendents earlier this week, and we're agreeing to try to meet, if not weekly, bi-weekly. I really don't know if I can give an answer to that question. We are trying to avoid the further spread of the coronavirus in the community, and the best way to do that is to have people still at home. We have a larger outbreak than comparable communities our size. We actually have more deaths than some states do, so we know we have an outbreak here. It may not be the same size as New York City or Long Island or Westchester County, but we have a significant issue that we have to deal with here, and we all need to pitch in. The determination with regards to the future of our school year is going to be made not just by school districts, by New York State, by examining the data. And the state education department will be providing directives to school districts, and we will just work with them to do what's best for our community.
Thank you.
Aaron, Buffalo News, any more questions?
Yeah, I got a quick follow-up on my last question. Just to be clear, is the capacity increase for testing because just there are now more supplies available, or is there something else behind it? And then also, is the 80 to 100 test capacity at the county lab changing?
There is more availability locally. Kaleida has more availability locally. They've been able to ramp up not only the receipt of testing supplies, the test kits, so to speak, but they've been able to increase the number that they can do on a daily basis. You could have as many test kits as you want, but if you can only do tests for 50 people through the equipment that analyzes it, it really doesn't matter how many test kits you have. So they've been able to ramp up their test kits. We've pretty much stayed the same with regards to the 100 or so that we can do per day. One of the things that we're actively working on right now is getting the appropriate equipment and supplies for the antibody tests. It's going to be very important that we have the antibody test to determine who actually was exposed to the coronavirus and might not have had the illness COVID-19 from symptoms, but if they've had it, we'll know that it's okay generally for them, as long as they're not symptomatic, to return to work and things like that. And so we are working very hard through a number of sources. Of course, everyone knows about the Abbott Laboratory one, and I know our team is working very hard and I believe has an order for a number of the Abbott Labs analysis tools. But we're also looking at a company that's been approved by the FDA that's based out of Monroe County and acquiring their equipment so that we can have as much antibody testing as possible. We are not at the point where we're there yet, but hopefully soon we'll be able to talk about antibody testing to make testing much more available to the general population to determine if they had contracted the coronavirus, and that'll give us a much better idea of what we have to determine in the future. Last question, Ethan Powers.
All set for now, Mark. Thanks.
Okay. Well, thank you everyone for joining us for our COVID-19 outbreak update, basically a full hour of information. We are going to be doing these on Monday, Wednesday, and Friday. We're not going to be doing them every day of the week. We do not plan on having them on the weekend unless we have to because of new information that has to be shared with the public. So the public should be advised that we'll be doing these on Monday, Wednesday, and Friday. I want to thank Dr. Burstein and her team from the Erie County Department of Health for the work that they've done to create a safer community for all. They're working many, many hours. There's a lot of folks in county government are working many, many hours from various departments. I want to thank all of them for the good work they're doing. I know a lot of people want to get back to business as usual, but we're not there yet. We're not ready. There's a reason why we shared that data with regards to Cuyahoga County and Allegheny County. Those are communities that have 300,000 more people in their counties than Erie County has, and we have many more cases and double or triple the deaths. So that just tells us we still have more work to do to get through this. I'm hoping we're reaching the peak, if not now, soon, rather than what the modeling says, but until we can definitively say that we are on the downward trend, we still need to continue to follow proper standards of social distancing, being physically distant from each other, and now, based on the governor's proposal, or order, we have to wear our masks. So when you're out in public, make sure you wear your masks. I will. Take care, everybody. Be safe, be well, and wear your mask.